County health officials are visiting specific parts of the county to get more people to take the COVID-19 vaccine.
And it's all happening at a slower pace than they had hoped. Senior reporter John Palmentary joins us now live. And John, most of these sites are in the North County.
Earlier this year, Santa Barbara County health officials had hoped that the numbers would be much higher than they are now, even though they said today that things are improving. With that, they're going to some specific areas where the vaccinations are low, and they're starting to do some intensive outreach. Santa Barbara County supervisors were hoping to have 80% of the population with a COVID-19 vaccination before summer. They are closer, but not there yet. The latest numbers show 66.6% of the eligible Santa Barbara County residents are fully vaccinated.
The dashboard, and 75.1% of people now have taken at least one shot. I wasn't sure we were ever going to get to that 75, but at least that tells you that 75% of the people believe in the vaccine, that they're willing to go take a shot.
The county says it's also been doing specific outreach to areas where vaccination levels are low, and recently those numbers have gone up. The outreach has been mainly in northern Santa Barbara County, in communities including parts of Santa Maria, Guadalupe, Sisquoc, Gary, Orchid, Vandenberg Village, and Casmelia. Santa Barbara County supervisors have also been told the number of new cases is no longer spiking, and the number of intensive care unit beds in use at area hospitals has gone down. The latest numbers show the most new cases are in ages 64 years old and younger. A county doctor briefed supervisors on how medical research is coming out about the accuracy of testing. And one supervisor wants that kind of update more often because of so many conflicting reports getting to the public.
How some of the things, unfortunately, that are being said are just so untrue. And it's important to tell the truth and tell it directly and tell it clearly.
Amidst all the data came a question about the future.
At the beginning, it was to flatten the curve and make sure that hospitals weren't overwhelmed and people could do their jobs and meet the needs of our community. And it seems like that's changed. And now, my question is, are we trying to stamp out all cases?
One county supervisor said her godchild was impacted, and she worries about impacts ahead on children.
A third of his class came down with COVID, including him. He's been 2 weeks at home with a fever of 103 and 104. His parents are so concerned.
What's still to be seen is if in-person learning at our schools, the return to schools overall, including UCSB, still coming up, social activities and the holidays ahead will create any more change in the numbers that'll be a serious concern for health officials. Reporting live in Santa Barbara, I'm John Palmentary, News Channel 3.
All right, great information. Thanks for the update, John. Coming up next on